Beyond exists to really improve access to mental health interventions for young people, and the reason why it's so important that we do that is that there are thousands of young people on waiting lists for mental health services or who have been rejected from mental health services, and these young people are all still expected to go to school regularly with no interim support for their mental health and actually achieve what is laid out as sort of academic expectations. So that's what Beyond does.
The issue you're describing is one that exists in Gibraltar. I feel many people report a lack of access or difficulty in accessing the mental health services that perhaps should be in place. So what exactly can Beyond do in filling in this gap?
It's really about making sure that young people from a really, really young age are emotionally literate, that they're able to express what's actually going on for themselves. And as a society, it's to make sure that those young people know what services do exist and what they can access in the absence of anything. It's really about embedding an education at school level from the moment that young people hit formal education around mental health and well-being as a whole, so that as a society we're basically trying our best to really raise a resilient and emotionally resilient generation.
We're targeting everyone from early years, so the start of 3-4 to up until further education. So we have a youth board at Beyond, and they're really the drivers of the charity, so they range from years of 11 to about 40s. But they're the next generation, and they're the voices of the charity, and they'll be the ones driving who we work with, what projects we work on, how we decide to drive this change through Beyond. It's based particularly on social media and digital wellbeing, and Louisa Rose is also an expert on the subject. So we tie it in with young people's mental health and how social media can impact how they grow up and see the world.
Both of us have experienced mental ill health, mental challenges since we were very, very little, and everyone in the organisation as well has. So we understand the challenge of being a young person in a world that didn't necessarily understand how to talk about mental health. The great thing is that as a world we are changing and we are shifting the dial on this conversation, and the schools here are doing a brilliant job of that, because we spoke to 9-year-olds yesterday in Gibraltar who were able to tell us where the emotion of anxiety sits as a physical experience in their body, and that's something that neither of us could do when we were at school because we weren't equipped with that language. So we are seeing a shift. We need to see more, and there really needs to be a kind of step change in terms of interventions and support.